Tonight we have 4 outstanding speakers who are well versed in hip fractures. The first JBJS article on intramedullary versus extramedullary fixation for unstable intertrochanteric fractures will be presented by author Dr. Rudy Reindl. Dr. Reindl is an assistant professor of surgery at McGill University. Our second author, Dr. Eric Swart, is an orthopedic surgery trauma fellow at Carolinas Medical Center. He will present his paper about cost-effectiveness analysis of fixation options for intertrochanteric hip fractures. Each author presentation will be followed by commentary. Dr. Reindl's presentation will be discussed by Dr. Clifford Jones, who is the National Chief of Orthopedic Traumatology and Bone Health at the Core Institute. Dr. Swart's paper will be commented on by Dr. Michael Archdeacon, who is the J. Peter Stern Professor and Chairman at the Department of Orthopedic Surgery at the University of Cincinnati College of Medicine. We will save the last 15 minutes for questions from the audience. The questions can be sent in at any point during the presentation. Dr. Swinkowski will help me identify the most relevant questions, and I will direct them towards one or all of the speakers. So with that, let's begin with our first speaker, Dr. Reindl.
Well, thank you very much. I would like to thank the JBJS for allowing me to present this really collaborative effort of 9 university centers in Canada looking at the intramedullary versus the extramedullary fixation for unstable intertrochanteric fractures. This is a prospective randomized controlled trial. And here are some acknowledgements, just people that did a lot of work on this study. I'd like to just have their slide up there for 1 second, people to know. As it was already alluded to, this is obviously a huge issue. You can see that over the past couple of decades, the use of the intramedullary device has skyrocketed from only about 3% of hip fractures being fixed in 1999 with a nail up to almost 67% in 2006, and certainly at this point the numbers are likely much larger than that. And all this happened despite really any clear literature favoring the intramedullary device. Here in Canada, the implant cost difference is quite significant for every intramedullary device. The cost is about equivalent to 3 to 5 extramedullary devices, so it's not negligible and something to keep in mind. The current literature does not differentiate between fracture types, and I think it's pretty clear from literature at this point that the simple intertrochanteric fractures really can be treated with either device, but certainly if you want to have cost-effective treatment, the extramedullary device is superior. There's really scant literature around looking at clinical and radiographic outcomes in these particular fracture types. So what we wanted to do, as I mentioned already